first of all, wishing you very happy new year. I hope everyone would be. What happened? Yeah. Is there anything happened? Okay, perfect. So I hope everyone will be getting the expectations of their own, like the training, as well as they will be also be successful in the upcoming exams. And we from 360 Critical Care Academy and all the like the team here wish you all the best in your future endeavors. Myself, Dr. Tapas Kumar Sahu. I am looking after the 360 Critical Care Academy and involved in many of the academics related to the European diploma, also related to the Indian exams related to critical care and also Nephrocritical Care Society. Now, you all have been very I would say successful in your training period till now, and you have successfully completed your the critical care training till now. But if you are planning for the future critical care accreditation as well as some of the best qualification in the world, they are not easy, but definitely they are worth it. So, are you ready to start the journey of critical care in the European diploma? Definitely, it is achievable, but yes, with a proper structure and proper curriculum. Now, there are certain well proven points why critical care medicine is now getting the proper spotlight in the all over like world as one of the most leading and also a very dynamic specialty. Now, critical care medicine super specialty is ever evolving from last, I would say, 20 to 30 years, but it needs focus, strategy, and practice. Now, if we are considering the European Diploma of Intensive Care examinations, they are more comprehensive nowadays and they need proper planning, strategy to appear and also pass. Why I'm saying to appear? Because to get a seat also in the EDIC registration process, that is also a battle, I would say, because once the registration process starts, the seats are getting filled up within maybe I would say 6 hours, 8 hours. Sometimes people are really worried that they are despite all of their preparation, they are unable to secure a seat to appear the exam. Forget about pass or fail. Now the preparation, if you are getting a seat, then also your preparation needs to be guided, and that has to be started early for success. I am not going into the details of how you should be starting your preparation because Dr. Alisa would be discussing and also our invited faculty would be also discussing in detail. But the problem right now, the trainees all over the world, they are facing is they are overburdened with informations. There are a lot of informations right now online. They are also having their own hospital training, the curriculums. So definitely the academics is heterogeneous, and also they have workload, volume of patients to attend. They do not know what to read, and more important, what not to read. And again, we are all right now not in our basic primary medical school days that we will be putting all our effort for 14 hours, 15 hours just for reading. We have also right now entering into graying of our gray and white matter along with also our hair. So definitely we are not like maybe 10 years before or 15 years before when we were in the school or college reading continuously. So definitely we need some help, and here we are there to help you. And definitely 360 Critical Care Academy and our course would definitely help you in form of advice, help, support, tips, guidance, and assistance. One disclaimer from our side, this is not an official presentation from the ESICM, and whatever we are right now discussing, this is based on our own experiences and also while preparing for the exams when we were the trainees and also teaching over last 4 or 5 years. Definitely, you are free to take follow your own path, brain and heart. But yes, these are like some of the courses which have been designed in a systematic way to make you clear the upcoming EDIC 1 and EDIC 2 exam. And I hope you all should be holding this prestigious European Diploma in Intensive Care, the pass certificate, after successfully completing the EDIC 1 and EDIC 2. Now, some of the information related to this year 2026 EDIC Part 1, which is part of our discussion today. The exam dates are, the spring session is 8 April 2026. Please mark your calendar. Registration opens 13 January, which is tomorrow. So today is 12th January. So we deliberately kept our webinar just one day before so that we can also remind you that if you are interested, tomorrow is the date. And please like buckle your seat, because the seats are going to be filled up within maybe 2 hours, 3 hours, 4 hours. So you have to be ready from now with all your documents, very strong Wi-Fi, opening your system, your laptop. Maybe two laptops would be better than holding one laptop, or like no, don't try in the mobile also. Sometimes it will hang up and you will lose your like no the chance this time. Now the autumn session, if you are planning for the next session, it would be 15 September 2026, and registration opens 5th May 2026. So these are the two dates that you should be remembering. Registration for the spring session is tomorrow. Registration for the autumn session is 5th May. Now, the exam format, Dr. Alisa would be discussing in detail, but just for the sake of the EDIC 1, 3 hours, 100 MCQ, type A, type K, and the syllabus is core intensive care medicine knowledge. So pull up your socks, friends, because it's not good enough to be just like thinking about planning, because there are only 2.5 months to go for your spring session, which is on 8th April 2026. Now, from my side, before I will be handing over the discussion to Dr. Adel from Dubai. So this is EDIC 1 preparation strategy. It's not working hard, rather I would say working smart. And that holds true for all of you, because if you are planning to do it, then you have to work smartly from now only. First mantra for your preparation: understand the exam first. EDIC 1 is equal to knowledge plus pattern recognition. It is not memorizing the theory, the concept, rather how you are actually applying or utilizing your knowledge to recognize the pattern. And they are all concept driven questions. The 100 questions, whether it is A or K, they are concept driven. Now, what to study? I would not go into the domains, rather the last line, focus on why, not just what. Because the questions, maybe you will get some of the straightforward question in the A type, but the K type would expect you to know the concept in depth. Now, how to study? My advice, piece of advice would be, read with clinical scenarios in mind, one standard reference plus MCQ oriented notes, and convert every topic into one line take home rules. Maybe that would help you. Now, daily discipline from my side, 2 to 3 hours per day into maybe 2 months or 2.5 months or 3 months from now till the date of your exam. Short repeated revisions beat long reading marathons, because you cannot continue with the same pace every day for 3 months. So you have to go with the short repeated revisions. Now, the winning formula, I would be advising all my trainees: MCQ mindset. It is a MCQ exam. It is not theory exam. It is not bedside exam. It is not practical exam, OSCE based exam. So eliminate wrong options first. Beware of the absolute words. Always, never, all these words are very important. Sometimes you know, but you actually don't put focus on the always or never type of word. Read K type question statement by statement. Now, there are certain high yield focus areas. We will be sharing with you all the details in our subsequent classes and our webinars in our course. And now, practice is equal to success. Do MCQs daily, not just after finishing the syllabus, and analyze why an option is wrong. Don't only be happy if you get the right answer. Rather, you have to also think about why the B, C, D options are wrong. If A option is right, you have to also think about B, C, D. Now maintain, rather I would advise you, this is something new concept which is coming up, mistake notebook. Rather than important clinical pearl notebook, I would advise you to write or make one notebook which is full of mistakes that you have done during your preparation. That is very powerful, and that would be coming very handy in the last 7 days of your exam preparation. Now final week mantra, revise notes, not new books, because the time is right now we are overloaded with information online and from the books. Trust your preparation. EDIC 1 is very crackable with structured thinking. So I would be definitely advising you try to create this type of small cheats where you can schedule your time throughout your day, throughout your week, and prepare from now. EDIC 1, last slide maybe from my side. EDIC 1 rewards clarity, concepts, and calmness. So 3C, not the 4C. That is not only cramming your theory, your textbooks, your resources. So with this, I hope I have tried to introduce you the strategy for going ahead with the EDIC 1 preparation, and also remember the dates, important dates. And now I request, and I am really privileged to have with me Dr. Adel Mohammad Yashin Al-Sisi, who is the consultant intensivist and head critical care and chief medical officer, Dubai Prime Hospital, United Arab Emirates. He has a lot of, I would say, the affiliations and accreditations. I would continue. Maybe the webinar will be full of this discussion only. He is the program director of the Dubai Health Authority. He is also one of the American Critical Care Board member, FCCS, MCC, RC instructor, and also he has been associated with Technosepsis program years after years. So welcome, Dr. Adel, and I hope your insights would be really coming helpful for our trainees.
Thank you, Dr. Tabat, for the invitation, and thank you for the introduction. Good evening, everyone. I'm really glad to have this session with the candidates who applied, or who those who will apply tomorrow for EDIC Part 1 in April 2026. Really, when we have such kind of enthusiasm for those doctors planning to having this difficult specialty, or dealing with emergency cases and life-threatening situation, and selected to work in ISO department and critical care units, I think it's a big responsibility for each physician who selected to be part of this team. Part of this training, clinical training, is very, very important for each doctor who is planning to be certified to have EDIC, European Diploma of Intensive Care. Once he has practice and training in a critical care department for a while, after that he decided to be certified for this diploma. So he has at least 3 months earlier to the exam after registration, and he will be one candidate who will join Part 1 exam. He has also a period of well preparation until he reached to the date of the exam. Also, he has a lot of things to consider during this 3 hours or 180 minutes. With these 100 scenarios he will receive, we have, as Dr. Tabas and all of you know, that there will be 2 kinds of questions will be there, type A and type K. Type A, just we have the best answer of 4 to 5 answer will be given for each question, and so you have a single answer has to be there. This is type A questions. Regarding type K, it will be a statement, and you will have true or false for this statement. So you have to think well and also to take care of the time, because if you consider this 180 minutes for 100 questions, we need a space of time also, at least 10 to 15 minutes at the end to back again very fast for the questions. If you feel any question at the time it's very difficult or you cannot answer very fast, you can keep it later and try to finish as much as you can from the questions. You have the good knowledge, and hopefully for all of you, and wish all of you, inshallah, to pass part one EDIC exam as well. As Dr. Tabaz highlighted in the introduction, when we are talking about EDIC part one or any even other parts, we are testing here the knowledge and the core physiology of ICU or intensive care. So the knowledge is very important for us, and we'll talk about it. Also, the clinical reasoning for each scenario you will have, any case you will have. Also, there is, once we study and prepare ourselves for this exam, you have to know the reason behind this. Everything you have the knowledge, what we call the physiology, pathophysiology. So you have a knowledge and you have just a reasoning and explanation for each clinical scenario, or in different organ functions, and if something like diseases, pathophysiology, all these things you need to be aware of it. Also, the EDIC part one, when it focus in the decision making, not only the right or correct decision you took, you have to prioritize your decision. What is the next or the initial things you have to do? For example, in the question, what is the immediate action you have, or you have to take? What is the most important investigation or blood test you have to do? So we have a priority for this decision when you are taking. So the focus of this exam and the question inside the exam focusing on this concept, the core physiology of intensive care, the clinical reasoning, along with the priority-based decision making. It is not looking for the local guidelines for each country or internal policy of a place. They are not looking for also the rare diseases. So try not to waste a lot of time. Common is common. Don't try to feel that something rare I have to put in mind and always tracking or during the study to have all kinds of rare diseases and such kind of things. So please consider the common in diagnosis, and from this common is common also you will be simple, safe actions you will take for these cases, and the long also avoid and the test itself not focus on long theoretical explanation why long and sophisticated things. It's like straightforward, but consider the tricks in the scenario, but straight looking for the safe, fast, and simple action you have to take with each scenario. So think about what would a safe evidence-based intensivist do first. While we are preparing ourselves, we can say we have 3 phases before the exam. Then we'll go through the exam itself. So when we are talking about the preparation before the exam, we have phase 1, which is building the core concept, as we mentioned, and to understand well the ICU physiology. That's why making the MCQs become more logical when you have the scenarios and you start to answer each scenario. In order to make the matters easier and more simple to you, take system by system. For example, we started with the circular cardiovascular system. or you have after that the respiratory, gastrointestinal, we have renal system, we have what we call blood system, musculoskeletal. So focus on one system and try to study this system, and after that go to another system. And when we are studying and have this knowledge and core concept about each system, we have to focus why these things happen and what worsen the mortality if we have, and what are the immediate actions, because in ICU also a decision, as we mentioned before, and the immediate actions need to be taken to save patient lives and their critical and life-threatening situation. So again, when we are preparing ourselves in phase one, we have to get the knowledge. The resources also, when we are getting this knowledge, we have OH intensive care manual, we have European Society of Intensive Care Medicine, we have EDIC 1 syllabus, we have also short notes and slide, not heavy textbook we are expecting to study during your preparation, and shock physiology, acid base, electrolytes, acute kidney injury, mechanical ventilation basics, and sepsis pathophysiology. All these resources and topics, we call it high yield topics, you have to focus while you are preparing yourself for part one EDIC exam. For phase two, very importantly also to have this question-based learning, and we consider this practice of having these questions and the question banks also very important in your preparation for the exam. So we have to practice daily to have MCQs every day. You have once we have any source of the MCQs and you are starting to answer this MCQ, spend the time more on explanation than you have your scores. Don't score yourself, please. Answer the question, and after that, explanation for the best answer or the right answer. This is very important because you are getting more and more knowledge about this. And after that, ask after each question, what was the best answer and why the others are considered wrong. Very important during while you are studying and preparing yourself. In the exam, definitely you have to rule out the wrong. Maybe there will be confusion between one or two or maximum three answers. You have to reach to the best answer at the time. But while you are preparing yourself during the study in phase two, you have to know why was it this one was the best answer and why the other, not to only have the best answer and this is the answer. You have to know why the others are wrong. This is very important as well. And we have many sources of question banks like European Society of Intensive Care Medicine, EDIC MCQs, past test, EDIC, and ICM tutor. The rule here, which I put in the slide, if you haven't done more than 1,500 questions or MCQs, you consider yourself
Dr.
not.
Adele, sorry to interrupt. Your slides are not visible. Is it like that or
Because I share it. I share it.
Bhagyasri,
I
is it visible?
because all what I was. This is the fourth slide. I think it's not shared.
Bhagyasri? Visible. Okay, perfect. Yeah. Okay.
Visible. Okay, so okay. Can you make sure with all candidates it's visible, right? Okay, so we'll go to the next slide, which is phase three. While we are preparing ourselves, while we are study for the exam, still we are before the exam, we have exam conditioning, mean that I put myself like the examiner. So once we have this, what is the pattern recognition? I have to cover most of the system, like
Sir,
some
sorry to
questions.
interrupt, sir. Your slides are
Yeah.
not visible.
And all of you not visible?
Yeah,
Yes,
it's
it
not
is
visible.
not. Can you please again reshare? Yeah.
Yes, we will do that.
Yes, yes. We are sharing the slide, please. Just wait for 1 minute. In the meantime, Dr. Alisa, if you can share your screen, maybe Dr. Adel is having some difficulty.
Sir, just a minute.
Yes, yes, no problem.
My screen is visible, sir.
Yes, yes, your screen is visible. Dr. Adel will be waiting for maybe like 30 seconds. Don't worry. Maybe there is some internet connection error.
Shall I present or we wait for sir?
Yes, I'm trying to share again. So,
I just stopped sharing, sir.
what slide was
Yes,
shared before, yani from the beginning or the only last slide?
fourth side. I think fourth or fifth slide was running.
Then after that, stop sharing, right?
The
Yes,
phase 2 was the last slide which was showing the
yes,
screen.
But it was shown before, but after that, not shared, right?
yes, yes, yes.
Oh, that's fine. We'll do it again. Just opening one. Please to put there.
Yes, started screen share.
It's sharing right now.
Yes, yes.
Okay, so we completed this one. The rule, if you haven't done more than 1,500 MCQs, you consider yourself under prepared. We went through phase 3 right now before the exam, and you have to think like as if you are an examiner and you'd like to have this exam covering the multiple system, and you would like to test the knowledge for those doctors regarding this. So the pattern recognition is very important. We have some answers. You have to select the best single answer. You have true or false. Pattern recognition is very important. Also, common traps. So sometime when you are practicing and answering this question, and you start every day have 20 to 30 questions, so you know where will be the tricks, the trap coming from that. That's why the bank and sources of question, and you have to ask yourself from the explanation why it was the best answer. You will get why, and why the others are not considered the best answer or wrong answer. From practicing, you will discover these tracks and tricks. Also, the time management, it also is very, very important, because once we have 3 hours, it means 180 minutes, and this 100 questions, you have to keep at least at the end of these 3 hours, also 10 to 12, maximum 15 minutes to have a look again for all. We'll come to this part when we reach to the exam itself. Something which is very clear to be ready from the beginning, like algorithm for different types of shocks, and we have ventilation numbers. You have these numbers of ventilator tidal volume, the low tidal volume, and also plateau pressure, and all these things you have to be aware of it from the beginning. Electrolyte emergencies like hyperkalemia, hyponatremia, all these things is very important. Back also to the ethics and end of life question also will be there in the exam. Again, when we focusing on the study and well preparation before the exam, we'll talk about take system by system, not overlap or confuse yourself when you are getting the knowledge. Take cardiovascular system and finish it with its questions. After that, go through the hematology or the blood system or respiratory or neurology or gastroenterology. Will help us to make all together more and more information to go in depth and understanding everything, the clinical reasoning behind this, and why you consider this the right answer, the right approach. All these things is very important. If we are going to the respiratory system, very, very common in EDIC part 1 and in the exam. So we have ARDS definition, also very important, and ventilation strategy, interpretation of arterial blood gases, respiratory failure causes, and also weaning criteria when we have ventilated patients. Cardiovascular, also the different types of shock. You have to know how to differentiate. And also the use of important drugs, vasoactive drugs like vasopressors and inotropes, when to use it, which doses, and the main indication to use this, which one is the potent vasoconstrictive drugs, and what is the best choice to start with. All these things you have to get information and knowledge about it. Sepsis bundles is very important, and ECG and arrhythmias in ICUs as well. If we are talking about the acute kidney injury, renal system, and acid base, also the staging is very important for the Rifle criteria, KDIGO criteria, and we have renal replacement therapy indication when I have to dialyze or put the patient on machine. All these things have to be very clear to you when you have get this knowledge about the topics. Medical metabolic acidosis approach, high anion gap, normal anion gap. So what could be the reason behind this, and what are the different causes and the etiology for this? The electrolyte imbalance like sodium and potassium disorder. Neurology, we are focusing on the Glasgow scale and altered the mental status. Raise the intracranial pressure in your critical department is very, very important, and how you can measure it. MAP minus cerebral perfusion pressure, always to maintain the perfusion. We have intracranial pressure parameter you have to know, and also mean arterial pressure. Status epilepticus, brain death criteria, very, very important in critical care department, and when you have this diagnostic criteria for brain stem death. And we have sepsis, the usage of antibiotic and the empirical antibiotics, the source control, infection and control measures. This is very important in sepsis. For the nutrition and metabolism, this all high yield topics are very important. The enteral feeding, parenteral feeding, refeeding syndrome, glycemic control is also important in such kind of scenarios which are coming to you in the exam, and also for the consent to form in ICU, and also DNR and withholding versus withdrawing the support when we have a patient plus end of life, and if the futility, we have to know all of this. Once we came to the exam, so we have 3 phases as we discussed before. We have to prepare and study and the core knowledge, and after that the clinical reasoning and the priority based in this decision making. Then after that we have 2 answers this and every day the MCQs 20 to 30 questions per day, and after that put yourself in the examiner, what areas you would like to cover for the candidate to be aware fully about these specialties, and also the important scenarios they would like to offer to the doctors who are joining this exam, and has to be certified with the EDIC European diploma. So always ask, is the patient is unstable or stable? If the patient is unstable, what kills first? What is the first things makes this patient maybe to have mortality or worsen mortality? And what is the first safe step you have to take? This is the action you have to take. So from the knowledge, you recognize, I identified that the patient unstable. This is a knowledge. And what kills first? This is a knowledge. And what is the first safe step at the time, or the immediate action it means? Also, this is the priority of your decision, and it's a decision making right now. So stabilization of airway, breathing, circulation, ABCD is very important. Treat hypoxia before think about to go send the patient to radiology for CT to diagnose something. Treat hypoxia first. Also treat hyperkalemia before you talk about dialysis, because the patient will die right now with cardiac standstill if potassium is 9 on 10 and you didn't give calcium right now and give the measures which controlling the hyperkalemia. After that, arrange for dialysis, which is the right action, but not the initial important action you have to, immediate action you have to take. Also think about use of norepinephrine as a first choice, for example, in sepsis and septic shock, I mean, before you think about dopamine, because it's highly arrhythmogenic and causing malignant types of arrhythmias as well. Common mistakes that fail the candidates studying like MRCP or USMLE. Also memorizing, Dr. Tabas talked about, we are not here to just memorizing, that we have, as we discussed before, the core knowledge we have, the clinical reasoning, and also the decision making. Ignoring the ethics, something, and if you ignore the ethics, definitely will fail. Consent form, for example, refusal of treatment, for example, all these things have to be considered. Doing MCQs too late also will not helping us a lot, and overthinking real diagnoses will not help us. Common is common. A realistic weekly study plan. If you are all of you maybe practicing working in different working places and different ICUs. This is good also as experience and training and practice as well. But meanwhile, you have to prepare yourself for the exam. So if you are working doctor and practicing ICU and in ICU department, we request you to have at least up to 1.5 hours every day to practice and to study. After that, to go through the MCQs, 20 to 30 MCQs per day, and review again this 20 to 30 MCQs each weekend. And after that, you are focusing on one system. After you complete this system, go to another. And it means that per week, I have everyone from us has to complete 100 to at least 150 MCQs every week. It means that total 8 to 10 hours every week, more or less sufficient in order to prepare yourself if you are working doctor and have duties. Final advice from EDIC examiners: we reward safe, this is very important, simple, early ICU decision. From the knowledge we have, from the core concept we have, from the physiology and pathophysiology of diseases. Also, we have to take a decision with the scenario, the initial step, the immediate action, what is the first things you have to do. This is usually most important investigation, what you have to do. All these things you have to think about it all the time. We'll go to one or two scenarios for this today's session. We have a case talking about the respiratory system. We have a case who is 65-year-old man with severe pneumonia. He is currently mechanically ventilated, and ABG shows that pH 7.2 7.28, PaCO2 60 millimeter mercury, and PaO2 70 millimeter mercury on FiO2 6%. Plateau pressure is 32 centimeter water. And which the question now, focus the question, which intervention is most appropriate? So for example, if I have a scenario like this, I will have 5 answers and I have to select the best single answer, which is the best answer in this scenario. So read the question and start from the last line, which is in green here, because he asks you which intervention is not appropriate only, is most appropriate. Usually you have in the question something like the word most important, maybe the initial step, the most immediate action. So there is, read this line very importantly and back to the scenario, then go through the answer of this patient. All of us know those patients, once we have pneumonia, it means that the patient ventilated might have sepsis and septic shock. And from the knowledge we know that the plateau pressure, you would like to maintain always 30 centimeter water or less. So you got now from the last line, which is the question, the most appropriate. And we need to select the best answer for this question. So once you have patient ventilated, elderly patient ventilated, and this is a blood gate, there is other things you can consider. But what is the most appropriate? Definitely would like to make the plateau pressure less than 30 in those patients with sepsis and septic shock. So increase tidal volume, because it could be a right answer, because 7.28, it means respiratory acidosis. Maybe if I increase the tidal volume, there will be more wash at the time. The respiratory acidosis maybe will be considered, particularly CO2 is 60. Number A could be a right answer. Number 2 is increased respiratory rate, also could be appropriate action. We are still asking about the most appropriate action. And increase PEEP also could be if the patient is still having FiO2 6% and PO2, which is acceptable 70%, but still on higher requirement from the ventilator. So it could be also, we can do this measure. Reduce tidal volume is here also could be a measure. Why? When we are reducing the tidal volume, it will help us for the plateau pressure to come less. And this less could be 30 centimeter water or less. The last one, decrease FiO2, is still FiO2 60% and PO2 70 millimeter mercury. We can do a trial to make it 55%. So if you go through the scenarios, all action can be done, some appropriate, some not to be done at all, but some one answer only is the most appropriate, because again, this patient is having severe pneumonia. It means sepsis for those patients, and we need to make the plateau pressure to avoid the complication of a ventilated patient with high plateau pressure. And all of you know this complication. So the best answer will be for this patient, reduce the tidal volume, because here the plateau pressure is more than 30 and risk of ventilator-induced lung injury is high. This is as per ARDS strategy. We'll take another scenario talking about the hemodynamics in a septic patient. Has a following values. This patient has a mean arterial pressure 58 millimeter mercury, central venous pressure 10 millimeter mercury, lactate 4.2 millimole per liter, urine output 0.2 milliliter per kg per hour. Again, what is the next best step? So go start your answer from the last line in the question. What is the next best step? Not only the step, best step and the next step for those patients. I have information about this patient. He's a septic patient and we need to support him in order to be hemodynamically stable. This patient is still unstable because MAB is 58. It means it's still less than 65, which is our target in a septic patient. The CVP, that as a parameter, always the requirement from 8 to 12. So CVP is acceptable. The lactate is still high because the patient actually is still in shock state and MAB is still low. And urine output is still sluggish and very low again because the patient is still hypotensive and shocked. But the only parameter CVP 10 millimeter is acceptable because we already we would like to optimize the CVP. So in your scenario, you'd like to give loop diuretic to increase the urine output, or you'd like to increase PEEP more and more. Increase PEEP will make the blood pressure going down more and more. And we don't have any information about oxygenation. Start norepinephrine for this patient based on the parameter above, or we can give IV fluids. Maybe the blood pressure will be respond. That's why the urine may be increased. And the last one is start dopamine. From these answers, the patient answer A will not be able because the patient actually hypotensive, will not give loop diuretics, and we cannot give Lasix or furosemide for those patients still blood pressure. We have to optimize or at least to reach to the goal or target first. After that, you can give diuretic. Increase PEEP. Here, it will decrease more and more MAD and make the patient more and more hypotensive and shocked, and no information about oxygenation. If we're having two vasoactive drugs like norepinephrine and dopamine, think about the first choice in the norepinephrine is the answer. Would you like answer number D to give IV fluid for the patient? Actually, CVP here is 10 and the target from 8 to 12. It means that خلاص we give fluids. If we, in the question, the CVP is 3 or 4, it will be the best answer at the time and the next best step to give fluids first before you consider the vasoactive drug. But because we reach to CVP 10, so the vasoactive drug decision has to be decided, and the best one will be the norepinephrine. So the correct answer to start norepinephrine for this patient, and the reasoning again is that adequate preload CVP is 10, and for this hypotension, vasopressor indicated because the MAB is still 58, and you would like to reach to the target of 65 millimeter mercury. Thank you so much for your time, and we are here to receive any question from you, from all the candidates who joined us today. Thank you.
Thank you, Professor Dr. Adel, for explaining the detailed EDIC 1 strategy to prepare. So if we are having any questions, we can post in the chat box also till the end of this webinar. Now with this, we come to the last talk of our webinar tonight. And with this, I invite the young dynamic intensivist and pulmonologist from India, Dr. Alisa Chaudhary, who is the consultant intensivist and pulmonologist from Some Ultimate Hospital, Bhubaneswar, India. And she is also one of the core faculty of TRICS 1 course. So welcome, Dr. Alisa. Please start your talk.
Very good evening to everyone. Thank you very much, sir, for the introduction. Actually, I'm more into the IDCCM course, though EDIC 2 was the thing I had joined with the TRICS Academy. So actually, Dr. Tapas and Dr. Adele have actually done my work, made it very simple because they've covered extensively about what you should prepare and how should you study and attempt this exam. So, thinking that you are going to write this exam itself is a very big step because it's not an exam, it's not an exam which we Indians commonly face. So it is an added advantage if we successfully clear this exam. And because we know the EDIC exams are of quite high standards, it also gives you a good feeling that, you have aced such an, high level exam. So that thought itself is really great. And it's not very easy. Definitely, you have a lot of work to do. There are a lot of commitments, personal, professional. but the feeling that you have conquered this exam both in 2 steps is definitely worth it. So why are we worried? Because the way we are trained in India, it's quite different from the level of exams. So there's not proper structured course format for us. We prepare a very different way for our Indian exams. But I think the ISCCM has come up with certain things that, our IDCCM theory exam is actually at par with the EDIC exam right now. Our pattern is more similar to the EDIC one. That's why the people who are preparing for IDCCM exam in our country are actually able to do very good in the EDIC one theory exam also. Lot of workload, the patient volume load is also quite a lot. You don't have time all the time. I mean, you don't have all the free time to always, sit and prepare for this exam. And then you also think that how is it going to help you? So in corporate setups, it's like an additional degree, and giving a foreign level exam, it definitely adds to a lot to your credentials. So that ways it is quite useful. So as sir had already told, this is not an official presentation by ESISM. So whatever views you are seeing here is all our past experiences. You always can have your own path. We are just here as an academy to guide you how to prepare well for it. Because amidst all your commitments and work profile, you need some help. And it's very difficult to sit and study alone always for these exams. Group studies, discussions in WhatsApp groups are definitely going to help you a lot. So this webinar is basically for that itself. So it is a theory exam, and what is basically assessed is your theoretical knowledge and how do you understand these core concepts and how do you interpret them and how you apply them bedside. Okay. So it all will boil down that whether you have worked at bedside properly or not in your ICU, and all these physiology and concepts, have you applied them or not, while working at bedside and treating a patient. So it's a 2-step exam. Because it's an EDIC 1 webinar, we are just talking about EDIC 1, but the next part will be the practical based EDIC 2 exam. So why EDIC 1 exam? Because it's a very comprehensive exam, and a lot of diseases are covered, pathophysiology, you cover like the organ function replacement therapies, ethics, and all these things are not very usually very commonly covered in our exams. There's a lot of topics on perioperative resuscitation and communication. All these aspects also questions are being asked. So that's why these things which you may not have covered in your critical care exam in India, when you study about this and write an exam on this, it definitely completes your preparation. And going back through that physiology and pathophysiologies, it also updates you, regarding these ICU topics. So the pattern is actually a proctored pattern. That is, you will be sitting at your home and giving this exam. So it will be a proctor based. There'll be a constant check on you. Conducted twice in a year, as you already know. Multiple choice questions based exam. You have total 100 questions. Okay, so you have A and K type questions, and the results are percentile based. Now, the theory syllabus, actually, if you see, this is what the weightage is. Your majority systems are cardiovascular, respiratory, infections, organ system support and perioperative care. There's a focus on renal and CNS gastro. Look at that, 10% on end-of-life care, resuscitation and initial management, patient safety and health. So that's a very, very important part which is being covered in the EDIC 1, which we need to focus on. Because most of the, at least, if you leave the last 2 topics, apart from that, most of that we actually cover when we are reading for our critical care exams in India. But these 2 particularly, you need to focus a little more in the EDIC 1 preparation. Now, this is an A-type question. Dr. Adel has already covered. It is just to show you how the question is like, this patient undergoing chemotherapy for acute leukemia, neutropenic, has a rise of temperature, cough despite treatment with broad spectrum antibiotics. You have a CT which will have showing pulmonary nodules with halos and ground glass opacity, halo sign, and BAL suggests a diagnosis of aspergillus. So what would be the best treatment? Since it's a A-type question, they expect one answer from you. And we know the drug of choice in a case of aspergillosis would be, the first thing would be a voriconazole. But the main game changer are these K-type questions, because Single answer still is slightly easier because you try to work around all the options, you narrow down to two, and then you find the best answer. But K-type questions actually check, how strong your concepts are, how well do you know the subject, how well you have read also. Because in these questions, like for this example, the following have been shown to improve mortality in ARDS. So here you have to answer for A to E, you have to answer true, false, or true. Now, if all your four answers are correct, then, if four at least answers are correct, you have 1 mark. 3 out of 4 are correct, you get around 0.5 marks only. So, what we know has improved mortality. So, inhaled beta-2 agonist, so it's a false. Prone ventilation, we know it is true. Treatment with glucocorticoids, HFOV, it's false. And again, low tidal volume ventilation, it's true. So, this is what K-type questions are. You have to answer true or false, and that is how the options will be given. So this is very important because these questions you have to be slightly more attentive, and they are very good scoring questions. But for that, your concepts have to be very, very clear. And the more and more you attempt these K-type questions, and when you time yourself that, you have to cover, suppose 50 questions in 1 hour today, if you time yourself properly, it is of 50 questions in 1.5 hours, you know your speed increases and you know when to focus on. Okay. The other K-type question is like, what are the recognized strategies in prevention of VAP? So again, if you look at daily sedation holds, head-up positioning, prone positioning has no role, chlorhexidine mouth care, and daily ventilator tubing changes. So, the answers will be quite okay. You can understand them, but you just need to focus, think properly, and mark at least these K-type questions. Okay. Usually people think A-type is more better and K-type is scary. No, but if you really focus, you can do really good in the K-type, because A-type is something most of the people answer proper. I feel what is the feedback from many students that they find, they get intimidated a lot by these K-type questions. But all I always suggest the students is, to keep your calm and go through the question, understand what they're trying to ask you, and then go through the options one by one and try to, write your mark true or false. Another one, a severe acute pancreatitis, what all do we do? So aggressive fluid therapy, may offer little benefit after the first 12 to 24 hours. Broad spectrum antibiotics have no role. A CCT is not warranted at least in the first 48 hours. Early enteral nutrition is recommended, true. And stable patients with infected necrosis, surgical endoscopic intervention should not be undertaken within the first week. So look at that. It's about pancreatitis, but they have covered every aspect in the options, basic aspects. These things. We practice this daily. So you need to focus while attempting these questions. Now, after telling that what to read, we have many textbooks. So whichever textbook you had used to prepare for your critical care exams in our country while writing your final, whether it was IDCCM or DRNB or DM, stick to the textbook. Like for me and my colleagues, it was Washington. So we stuck to Washington. Packed modules are a must. Just like a storybook, go through these packed modules in ESISM Academy website. Once you enroll for these exams, these will be available for you. They can be downloaded and you go through these packed modules. The best part about them is every chapter, the information is written in a concise way. Certain guidelines and protocols are different from our country. So that is why you have to be a little careful and try to go through the chapters given in these packed modules. And most of the time, if you see, the packed modules are very good for revision and you get a lot of questions from that. If you have time, review articles with recent advances and landmark trials. That is where TRICS is going to help you, because you will get articles for every section, for gastro, what are the most important articles you should go through, and landmark trials as you must have prepared for your exam. Question banks, there are multiple, but my first choice would be Bennington, because Bennington actually in 2 parts gives you a very good idea how the K-type and A-type questions are. The only problem in Bennington is the answers are not updated. So sometimes you may find answers a little wrong or you're not agreeing, but the whole point of doing Bennington or Lobas is just to get an idea or a feel of how the questions are going to come in the exam. So apart from a standard textbook, packed modules for at least some high-yielding topics or high-yielding systems, one MCQ book, either Bennington or Lobas, and apart from that, if you are joining the TRICS course MCQ banks. Like Dr. Adele said, The more and more MCQs you do, the more and more you time yourself, you perform better, because the target is just not you need to get concepts and everything right, but the target is you to also finish the exam in time. Make sure you have gone through all the questions at least once properly. And apart from that, for short reading or like in a like quick reading or revisions, you have MCRIP Life in the Fast Lane Delaying Physiologies about short notes just to go through. But finally, nothing trumps your own notes, whether handwritten or the materials you've collected in tab, because that is the point where which is going to help you the most. So what me and my colleagues had done, actually, we used to keep a simple notebook. There are so many resources, right? Even if you go through them, where is the time to revise all of that? So we used to keep a small notebook which mentions that if today, if I this week, if I am going to finish all the questions in gastro, then I write down that these are the important notes of gastro I need to revise. These two articles are very important, I mentioned in that notebook. So when I'm revising gastro, I know that I have to revise gastro from this textbook. I need to go through these points from the MCQs I have solved, which I found. Suppose you have solved like 15 MCQs. You find that, okay, these 5 points were very important from these MCQs, which I have not read earlier, and I should note it down. So I should revise those notes and pack modules, whichever you have read and you have highlighted the points, you need to go through that. So try to write down in a notebook what all you have to revise at the end. That simple notebook should carry all your information, and that is going to actually help you to do the last minute revision. Otherwise, you will be going through a lot of resources, and at the end, the last 1 week or 15 days, you don't know which book to open, which MCQ to look at. So don't get confused. As Tapasar had already told, every day I would suggest, best thing is, once you get up in the morning, every day, time yourself and do some MCQs, go through the explanations. In the evening, when you come back, you can go through your standard textbook and pack module. That's how we used to divide our time. You won't find it that a problem, because I'm sure most of the people who are attempting in this group for EDIC 1 have already completed their critical care training. So this will be not that difficult if you organize and study smart. Okay. So more than the journey and the destination, it's always the company. As I said, it's very difficult to study alone these days. You have a dedicated WhatsApp group by TRICS where you can discuss with everyone, your doubts. You can put up your questions. There'll be questions put up by faculties also with polls, so that you answer any doubts you can discuss. That will be easier also. It will keep you motivated and interested to keep reading and keep discussing. And the more you discuss these short MCQs and concepts, it just keeps getting more refined and more strong. So how TRICS is going to help you? So you have all the materials available in an app. You have a lot of practice tests for you, and live doubt clearing classes. There are 10 module mock tests, 3 comprehensive mock tests at the end. Gives you a real EDIC 1 feeling, and you know that this is how it is going to be in the exam. So that in the exam, you don't have that MCQ fear, and you can, easily overcome it. The course structure is almost as similar as to the EDIC 1 syllabus by ESICM itself, focusing on the important modules, as I said. Module 9, and Module 9 is the most important module according to me, because that is something which we don't very commonly read or face MCQs in our exams. Success needs preparations, and that's how TRICS is going to help you. Thank you.
Thank you, Dr. Alisa, for elaboratively explaining the process of preparation and also sharing some of the A and K type questions, and also breaking the myth also that K type is always like the difficult. K type is high scoring if you know the concept very well. Now with this, we come to the last part about the webinar, that is how you can join the EDIC 1 preparatory course. And this is the course structure which is already explained by Dr. Alisa, and there would be 10 module mock tests, dedicated WhatsApp group, and the modules would be from module 1 to module 10, covering the ESICM as per the course guideline. And this is in in short, the modules would be from 1 to 10, and there would be grand mock exam 1, 2, 3, and then the final exam EDIC 1 will be on April 8. and this grand mock exam would be first one at the end of January, the second mock would be mid of the February, and the third mock would be early March. So it would be all recorded debrief sessions so that you can multiple times go through the questions and the answers, the explanations, and everything again comes very handy in our the app, where you will get multiple times, like you can go through during your hospital work also whenever you are traveling also and you are having some time, so you can go through maybe 10 questions, go through the explanations, take the exam there itself, check whether you are right or wrong, why you have been wrong in those questions, what are your the weak areas. All of these things will be coming very handy in the app. In the mobile also you can go through, and it is not always that you will be going through the system or laptop. We have the Android app link also, and the website address, and also the iOS app link is also coming very soon. There are a lot of the tutorials how you can go through. This is our website which is exclusively prepared for various critical care exit exams, both in India or India, also abroad in European exams, and lot of information have been added. And there are also some of the videos which would be created, have been already prepared for some difficult domains. Like if it is IABP, definitely it's needed little bit detailed explanation. If it is something related to ECMO, it would be requiring little bit more detailed discussion. So all these difficult domain would be added in your course curriculum in between, that would be helping you to go through those videos and clarifying your doubts. So I'm not going into the detailed process of the tutorial, how to download the 360 critical care app and log in and avail the different course structure and modules. But yes, here is the way where we can go through the detailed exam preparation at just a fingertip away. So with this, we come to end of our the first ever, we can say, EDIC 1 preparatory course, which is in an app. So I'm just trying to summarize the whole 1 hour 10 minutes discussion into two lines. You have to practice, 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 and that is the mantra for success in this type of highly competitive MCQ based exam. And the second point is time is essence. You have to start from now, because if you prepare and just maybe not able to get the secure the seat also tomorrow, definitely it would be disappointing. So first attempt would be to get the seat, secure the seat. And if you are interested in our course, please be in touch, and we will be definitely help you to get the success in the April 8 exam. So if you have any questions, please post in the chat box. Our team, our experts, our faculty would be happy to also solve the query to you, not only as part of the course, rather if you have any doubt also, we will be anyway happy to clarify those doubts otherwise. Thank you very much. Thank you, Dr. Alisa. Thank you, Dr. Adel. Thank you, Nabneet and Bhagyasri from the technical team. And thank you everyone for giving your valuable time in the second week of the January 2026 to do something which is now is your prime mission to clear the EDIC. Now, number of attempts allowed, they have multiple attempts, don't worry. So they prefer to finish it within maybe 1 or 2 times. But yes, there is no exact the attempt limit they have mentioned in the EDIC official website. So what time does registration open tomorrow, Indian time? Yes, you have to check it in the online format only in the ESISM website. If we will be going little bit wrong, then you will lose your precious chance. So please refer to the ESISM official website. That is a very difficult question by Dr. Minu. I get these queries for EDIC 1 as well as EDIC 2, that if we can help you in securing the registration or the seat for the upcoming exam. Believe me, this is all automated. No individual Wi-Fi or system can interfere in the registration process. But yes, you have to have a strong Wi-Fi. Your system has to be rock solid, and preferably have some other one beside you with another system. Okay. Yes, you should. Note 4 you should do, because you have already done 2 years of the dedicated critical care training. Which browsers to use? Maybe you can use two browsers in one system, maybe Google Chrome, in the other system Safari or Mozilla Firefox, so that one system browser will be like, if it is hanging, you can go through the other. This is the first battle before entering into the ocean of the EDIC. You just secure the seat, and please let us know whether you have the secured your seat or not tomorrow. Yeah, so the card will be, I think, blocking your amount. Yeah, this is a difficult question, but yes, definitely they will be checking that whether your credit card is active or not, or it has balance or not. BMJ on examination will be more of medicine related. As Dr. Adele has told, this is for MRCP. So European Diploma Intensive Care is more towards the acute medicine, and it would be extensively related to critical care. So if you ask me, I will be not recommending BMJ on examination, because this would be a more of MRCP based MCQs. But yes, the medicine part, maybe the critical care questions would be helpful to you, but not the complete the modules. Any question? Dr. Alisa, if you want to add anything for the queries?
No, sir, nothing.
Yeah, so MCQ pools, it would be more than 1,500 to 2,000. And I would be saying it is not the number, but yes, how deep you are into covering the whole spectrum of that domain. So if it is neurocritical care, so if you are covering all the important domains in that neurocritical care, be it no traumatic brain injury, be it ischemic stroke, subarachnoid hemorrhage, neuroinfections, monitoring, and also some of the atypical neuro related domains, then your whole spectrum is covered. And it is not important as well to always go for the numbers, but the quality of questions and how many times you are actually revising. And you have to also make your the study again, like last month you have to revise the whole whatever you have read in the upcoming 2 months.
And timing yourself is very important actually. That you
You
have to
will
finish
say
the target in 3 hours. That's most important.
yes, yes. Yeah, so Dr. Adel, I will be sharing the email ID. If he, I have to take consent from him. Definitely, there is no problem from our side. And you will share past papers, real papers, EDIC one. No, that is not allowed by ESICM. That would be conflict of interest. And anyway, we don't have, they don't no, the give it to the candidates. It is all Proctor based, online format only. But yes, as per the
The
feedback,
questions which are there in a question bank is actually a model based on that only. So
yes,
you get
yes,
a fair
yes.
idea about that.
Yes, yes, yes. Because we normally get the feedback and the memory recall questions from the last batch, one batch, two batch, and we try to create the questions based on the last the session asked questions. So these would be the exact replica of the questions, but not the like you would say the exact questions. Okay. Thank you very much. There were lot of queries and doubts. So I feel very happy that before your registration date, we could the organize this structured webinar, and there were so many doubts. I hope we have clarified through our faculties. Perfect. Thank you very much. All the best.
Thank you,
First
sir.
of all, for tomorrow, getting or securing a seat in the upcoming EDIC 1 exam. Then maybe the next step would be your preparation and success. You can do, Dr. Rao. Don't worry. Thank you, Dr. Gunjan. So this recorded version would be available to you all. If somebody has missed it, they can go through the recorded version of our webinar, maybe in 24 hours or 48 hours. Okay.